So welcome everybody. Thank you so much for joining us today. I appreciate that for some of you it's very early in the morning. So we are very grateful that you have been able to log on to join this very first community of practice meeting for long-acting therapeutics, maternal and paediatric health. My name's Rachel Daly. I'm the one who has been sending lots of emails to you over the past weeks and months. It's lovely to see some of your faces live today. I'm joined today by Dr. Adeni Alagunju, who some of you may know as well. And today we're going to be hosting this first online meeting. So hopefully you've seen a copy of the agenda already. Just a quick refresher. We are quite tight on time with lots to cover. So I am going to be quite stringent with moving us along. And hopefully that will work well. So we're going to start with some introductions. Everybody should have received a copy of the member bios. Again, thank you so much for your effort in communicating with me to pull those together. The reason for doing that is because we are tight on time, and I'm sure everybody wants to know who your fellow community of practice members are. And that gives a really nice flavour, as written by yourselves, of your backgrounds and why you want to contribute and how you're going to contribute to this incredible community. We're going to have a look at the objectives of the community of practice and have a group discussion about the terms of reference. And then we're going to move on to looking at the key themes that we will be looking to explore over the coming months and years. We're then going to do a rather exciting, I hope, rapid insight session, which the idea of that is to co-create the topics and format for our first in-person meeting. It says on here the 13th of July, more on that a little bit later. But also for the webinars and seminars that we have planned over the next 12 months. And finally, we'll wrap up and close, hopefully by 1:30 local time in the UK. Okay, so as I said, my name's Rachel. I am the coordinator, stakeholder engagement coordinator for this project, working with Dr. Alagunju's team within the perinatal pharmacology group at the University of Liverpool. I joined the university in October, and it's been an absolute pleasure and a very steep learning curve for me over the last few months to get to know the university, CELT, and also the work of the perinatal pharmacology group. And I do feel very privileged to be part of this and to be helping you as experts in your field to coordinate and bring together your ideas. Dr. Alagunju?
Thank you, Rachel. And I want to thank everyone for joining us today for this first meeting. So I'm the PI in the perinatal pharmacology group. The group is actually part of the Center of Excellence for Long-acting Therapeutics that many of you will be familiar with. The center is co-led by Professors Andrew Owen and Steve Renard. And this community of practice happens to be part of the expanded role that CELT wants to play in advancing this field. So that in addition to the research that we do to bring long-acting therapeutics to the market, we're also interested now in broadening the scope of what we do to really help the community in general. And we have been very fortunate to receive funding from United to drive some of this activity. And this community of practice is a really major part of that. So United is very keen to see what the group can achieve together. So I want to thank you for accepting the invitation to be part of the community of practice and also for joining us for today's meeting. Maybe in the future, there will be opportunities to tell you more about ongoing work within the perinatal pharmacology group, which is really focused on advancing our understanding of drug safety during pregnancy, lactation, and also a little bit of work in pediatrics now. So thank you.
Thank you so much. So for the first sort of 25 minutes of the session, we're going to be looking at the objectives for the community of practice and terms of reference. I did send a document round earlier this morning. I appreciate for some of you that might have been the early hours of the morning, so you may not have had a chance to have a look at that. Don't worry, we are going to be looking at that and discussing that live within this session this morning. You can use that document to add notes to or edit. You can send that to me after the meeting, or if it suits you best to share your thoughts during the meeting, that's also fine as well. Okay, so when we're looking at the objectives of this community of practice, as Dr. Olagunju said, we have been blessed, I guess, by Unitaid supporting this initiative, and we do have a couple of representatives from Unitaid on the call today, so welcome to you. So one of the key objectives is around collaboration, and that's about bringing together different stakeholder groups to work towards the advancement of the use of long-acting therapeutics in maternal and paediatric health. So the stakeholder groups you will have seen from the bios that we've shared range from academics, we've got people from regulatory authorities, we've got people from NGOs and other key healthcare sector as well, and other key groups who have already signed up, which is absolutely fantastic. We've been blown away really by the support and the interest in this really important work. Next, the objective is around sharing knowledge. As I said, we have so many experts who have agreed to participate and share their knowledge within this group. And the job of the community of practice and my role as coordinator is to facilitate that exchange of information, sharing best practice and research findings as well. That leads nicely into the drive for innovation that we're looking for, and encouraging the development of novel solutions ultimately, and approaches that we can work on collaboratively to achieve. Next, we're looking to enhance access and equity, and what that means for us is ensuring that long-acting therapeutics are accessible to all populations. And then that leads into the improvement of outcomes for patients, which is just so important. Focusing on strategies that will enhance the effectiveness and safety of the treatment for paediatric and maternal populations especially. Okay. So this interactive session, if you have received a copy of the terms of reference and you wish to pull that up now, feel free. If you want to scribble some ideas down with a pen and paper, fine also. And also feel free to use the chat and the Q&A box as well to share your thoughts if you would rather. If you have something to say and you'd like to raise your hand, then feel free to do that. And then we will summarise before moving on to the next section. So what we're hoping to achieve is an agreement on the purpose, I guess, and the scope of the COP. You've all expressed an interest in participating. You've seen the ideas and some of the vision that we've shared with you so far, but we want to be sure that you're bought in and you understand the purpose and where we're hoping to go with this. The objectives, as I've just covered, they are already agreed, but what we want to do is make sure that how we achieve those objectives is being really clear and really concise and agreed as well by all members. We also invite you to help us shape really the membership. Like I said, we've been blown away by the interest so far. However, we're not just going to say we're done. This is absolutely a work in progress. There will be stakeholder groups that we have not yet engaged with or that are underrepresented, and we want to make sure that's constantly being reviewed. So we invite you to share your ideas around that as well. Also, we'll have a look at roles within the community of practice and a little bit on governance. And finally, we'll have a look at the code of conduct. Okay, so in terms of purpose, everybody will have seen this. We've shared this in the expression of interest and other communications that have been sent to you. So I put to you now, is there anything within what we have shared here that doesn't make sense, that feels that it's lacking somehow, or is there anything else that we need to include, or is there anything that we need to remove completely? That's my first question. Does anybody want to make a start? Okay, Dr. Alaganju?
Yes, thank you, Rachel, for the nice introduction. I think something that jumped straight to the fore for me is something around occasionally we make attempt to see how can women be protected when they are taking long-acting therapeutics. To give an example, imagine someone who starts using one of the approved antiretroviral drugs, and then she's of childbearing age, and then she gets pregnant. Occasionally, the treatment is terminated because of pregnancy. But from what we've seen, there is a very long tail to this treatment. And even though she has stopped treatment, but the exposure still continues for a long time after delivery. So, and I think that's one of the areas where there is a significant gap in our understanding, because it really looks like we can't really stop it unless it's a removable type. So is there a way we can improve understanding of this, of the safety of this treatment, instead of finding a way to stop them when in reality they're unstoppable? So that's something that I think could also come into one of the gaps that exist at the moment. Or
Brilliant,
another way
thank
to
you.
look at that, yeah, sorry, another way to look at that is it might be, it also brings to mind the possibility of looking for ways to protect the tail, like we describe it, so that resistance does not develop, especially if it's a single drug.
Okay. Does anybody have anything to add to that, or any other thoughts about what Adeni has just shared? Okay, is that Sharon?
Yeah.
Hi,
Good morning.
Sharon.
Sorry. Thank you. We're very interested in that exact question, and I want to say on the long-acting injectables for HIV treatment, the Impact Network actually has a clinical trial rolling out, I want to say shortly, that will ask that exact question. Can they stay on medication during pregnancy? What are the right doses? What's the tail to the baby? And how the moms do postpartum during breastfeeding. So I want to say we 100% agree with you. We feel that is a significant gap, and we're working with our pharma colleagues as well as NIH. I won't get into that right now, but to make sure that those questions are exactly understood. So we agree with you. We are not studying stopping the medication during pregnancy, but rather continuing it during pregnancy.
Okay, thank you for sharing. Is there anybody else who'd like to? Okay, Joelle?
This is Joelle from Treatment Action Group. I know it can be a tricky time, especially here in the US, to raise this, but I was just curious if you've thought about the use of the word women here and how more inclusive you could perhaps be, to ensure broader gender diversity, and take into account that, we don't necessarily only have, I guess, cisgender women, gender women is what you mean here, who bear children. I was just wondering if that's something that you've kind of thought about. Yeah, just curious. Thank you.
Thank you, Joelle. That's something really important to take on board. And we will definitely have a look at more inclusive language that we can use so we don't rule out any part of the population. Thank you very much for sharing that. Charisse?
Hello, everyone. From Unitaid. I just wanted to ask if we could start to incorporate more language also around access. and thinking around that, both in the purpose and I guess as we go forward, just can we say development and access aspects so that we can encompass that in that. And then I also wanted clarification because I was wondering whether this group is focused specifically on pregnant and lactating women, or is it supposed to be more general? So that would be one in reference to responding to what Joelle had mentioned as far as an addition. So I think we need to clarify the scope of who we're going to be addressing within this group, and then and then as well with children, to make sure that we are encompassing the breadth of children, because we have seen in some instances where infants get left behind or neonates because we focus on a specific aspect of children. So just wanted to make sure that we are being inclusive and clear on who we're addressing here.
Thank you, Charisse. Sebastian?
Yes, hi everyone. Sebastian from Medicine's Patent Pool. I just have a clarifying question. From the way I've seen the documents, this seems to be disease agnostic, but I can see that the members, but already the conversation is hinging on infectious diseases with possibly a lot around HIV. So I'd like to just ask, what's the intended scope in terms of therapeutic areas? Thanks.
Dr. Alagandri, do you want to respond? Yeah.
Yes, thank you. Thanks a lot, Sebastian. Very quickly on Cherry's comment. So the focus is on pregnant and lactating women. That's the focus, really. I think we struggled a little bit while trying to come up with the name so that it's not too long and too wordy. So we chose maternal instead of saying pregnant and lactating women and pediatrics. But we really welcome any comments on how we could modify that if necessary. But very good comment from Joel regarding inclusion as well. So, and then following that, Sebastian comment regarding the focus. So it's disease agnostic. So you're quite right with that. I think the reason why there is a lot of representation from infectious disease area is because one, we've done quite a bit of work in that area. While our work in CELT is disease agnostic, but if you've been following, you notice a lot of these have been on infections, and I think that may be one of the factors. But I think more important will be the fact that it's an area where there is a lot of rapid development ongoing. It's a really hot area, and we think this is an area that will really help us to gain the kind of knowledge that we need to advance this field for every therapeutic area. But of course, we're making effort to make sure we have inclusion from other therapeutic areas, especially where there might be differences in what is applicable and what is not.
Okay. Thank you for those responses as well. So what we will do, we'll take on board the comments and the feedback here. We will redraft this section and share back with you for further comments and approval as well. So we'll move on to the next section. So we've called this scope, but even just this morning, myself and Denny were having a discussion about this section. Any initial thoughts about scope? Now, obviously, the objectives, as I said earlier, they are they're predetermined. What we're looking to achieve, that's predetermined. But in our terms of reference, are we capturing this appropriately? I see a hand up already. Is that Gary?
Yes, thank you, Rachel, and apologies for joining late. I had issues with the link, but I'm here now. Okay. In terms of the scope, I think I'd like to see the insertion after you have the availability of long-acting therapeutics of value. I think it's more appropriate to say of public health value. So value personally to women, but also to the larger, broader community. So I think public health value would be more fitting, or at least for consideration for women of childbearing age and children. And also close to what Cherise had mentioned about accessibility, I wonder if there are, whether the scope would consider products that are fit for purpose in resource-limited settings. So I'm not saying that we need to be prescriptive about what those are, but things that are, heat stable, for instance. So if we could capture that more broadly, that covers some of the constraints or some of the challenges or some of the field situations and the context in LMICs, that also is something I'd like to suggest, although right now I don't have a word that would cover that. So two suggestions, one on the value and second is on being fit for purpose in LMIC settings beyond availability and development. Over.
Brilliant. Thank you so much for that input. That's fantastic. Is there any further comments on that from anybody else within the group? Any other thoughts? I see Elaine has put in the comments, by studying pregnant and lactating women, you get important info on newborns and infant PK as well. So anything that you put in the comments or the Q&A, we will take into consideration when we're looking at this redraft as well. Okay. We should move on. Okay. Dr. Lagangio?
All right. Thank you, Rachel. So we put this up here. This is not currently included in the document that was shared with you, the terms of reference, but it's something we're going to add later on. So these are the outcomes and the impact that we presented to United that actually made United love what we're planning to do. So we thought we should share that with you. So we're thinking that one of the key outcomes will be publication of white papers and articles in peer-reviewed journals. These will be things that would be output from the different activities that we will be engaging in. One example will be, imagine we have our first workshop sometime in July, and then we could get together and make a decision about maybe publishing the outcome of that and summarizing the discussions as a peer-reviewed publication. Website traffic is another one that we think will be a major outcome. So when we are able to achieve and show growth in how many people are accessing the resources that are published, then we included linkage to other initiatives and other stakeholders. For instance, there are a lot of stakeholders working in the same area. For instance, some research networks like Impact and other research network conducting clinical trials, organizations focused on long-acting therapeutics or focused on the populations that we're interested in. So how we link with those, how often they cite our resources or we cite their resources, or we co-organize events, all of this will be part of the outcomes that we're looking at. And these are the major impacts that we think we should be able to achieve. The first one is uptake of the recommendations that come out of our activities. This could be uptake by organizations in low and middle income countries or organizations outside these settings, but that are interested in advancing health care provision in those areas. The second impact is new targeted funding opportunities. For instance, we might organize an activity, and in the course of our discussion, maybe there are some gaps that became really evident, and we publish those gaps as part of the outcomes of our discussions. Some organizations might pick up some of those gaps and make a decision to target some funding opportunities to fill those gaps. New clinical trials, for women and pediatrics is another one, especially in low and middle income countries. New studies addressing key questions that were identified. So the goal is to really have a way to monitor development in these areas and see how our activities are encouraging our progress in all these different areas. And you might be thinking already about sustainability. So the plan is to make all the resources that will be developed from the different activities to make them available as web resources on CELT website, which is hosted by the University of Liverpool. So that way we'll be able to ensure that these resources will continue to be accessible even beyond the funding period. So I'll stop there to see what you think about these outcomes, impact, and sustainability.
Do we have any questions or any thoughts on this? Patrick?
Thank you. I wanted to appreciate the outcome and impact that are set. They are clear, but again, we will need to break down into the focus of the publications and how they will come to trigger the conduct of new clinical trial in women. And again, what I would like to add is the way of dissemination of the findings to the right groups of those who are conducting the research in laboratories, those who are involved more in designing the clinical trials, so that they could gain information that we could develop a strategy in which our dissemination plan will go beyond just the website, and we will ensure that it reaches to the target. It's true that those who are interested will reach out to the website to gain more information, but to maximize to those who don't know about the current initiative. So we need to target them more deeply. Thank you.
Thank you, Patrick. Those are really valuable contributions, and we've noted them down. Thanks. Thank you, Maud, for mentioning ethics on representation. So that's really important. So far, we've had none, but I think we need to make a special effort. And if you're able to maybe recommend someone, that would be great.
We will go on to that in the next session, in the next part of the terms of reference when we look at membership as well. So, Gauri?
Thank you again. So I think might require a little bit more time to think these through, so I can, revert back after the call is over. I was trying to make the link with the purpose that you showed earlier on, and I think when we look or reread that purpose, it's about closing those gaps in availability of medicines. So with that hat on, I was wondering whether we would want to consider some of the impact and outcome measures that you have there. Things such as growth in website traffic, I would consider not a major outcome, but something that will certainly be an activity that will happen, that you will, embark to do and through your dissemination. But I consider perhaps the availability of medicines, which is what the purpose speaks to, would be an impact that we could consider. The second is on the uptake of recommendations. I'm not very clear who the targeted audience here is and uptake by whom. The recommendations normally have to be peer reviewed. There is a process involved. So this is a bit unclear to me as to what this essentially means. This is just some initial reactions on the outcomes and impact, but I'm trying to see how we can link it with the purpose that was showed earlier. And I think maybe relook at some of the outcomes and impact measures might be warranted. And I can certainly think through more after the call. Thank you.
All right. That will be appreciated. Thank you.
Brilliant. Thank you so much. Okay. Conscious of, Andrew, before we move on, feel free to jump in. You caught me just in the nick of time.
Sorry. Thank you. I think kind of follows on from the last point as well. So in terms of recommendations and maybe also publications and things, a lot of these issues they're not specific to long-acting therapies. The lack of data in pregnancy, paediatrics, perinatal is generally a wide issue. Work looking at recommendations, there's ICH guidance being developed. Conception have done lots of work around it generally, and just I guess I'm not concerned, but it would be good to be aware and sort of link in with the other recommendations that are being put into place and making sure that everything is giving a consistent message, assuming that we do as a group agree with the messages presented elsewhere. And that's something I think might be quite important.
That's great.
Yeah, that's really
Thank you,
valuable.
Andrew.
Thanks.
Yeah, and also, we very much hope that as members of this community of practice, you will be able to bring and link us in, relevant members of the community of practice into these conversations that are happening and the work that's happening outside of the community of practice. We just certainly don't want to duplicate any work, and absolutely align ourselves where that's appropriate. So thanks very much, Andrew. I'm going to move on to membership now, which sort of segues quite nicely, really. So I've captured some of the stakeholder groups here that we're saying that the community of practice is open to, and what we are, as members, what we are agreeing to contribute actively, sharing our expertise and engaging in the community of practice activities as you are doing now. What I would like to pose to you as a question is, how do you think that we should monitor the membership? And what I mean is it's that representation and inclusion piece, but also should there be any caps on certain stakeholder groups or on all stakeholder groups? Is there a sweet spot? How do you, as a member, want that to be sort of reviewed and managed? Any initial thoughts on that? I appreciate some of these are quite big questions and may need a little bit more time than we're allowing today, but any initial thoughts? Hi, Sharon.
So, I think there are different needs for the network. And I think that's really what's going to drive the membership. I think of it as a governing body and then a larger membership. You don't want to restrict the larger membership because you don't know who you're going to need over the different pieces of time. So I think the larger group membership, you have to be very much more inclusive. I think for a governing body, you have to say, what are the needs of the governing body? Do I need to have an academic? Do I need an industry person, a patient group? You need one of these or one of each of those, so to speak. And you need a rotation of you're going to be on for 2 years or 3 years, and then you rotate off, and that, title of what that person was. It's an academic person, then someone else rotates into that academic spot. So I think there are two different needs that you're trying to address over here. And I think there are different responsibilities for those two different groups. One is a time-limited rotation. One is a more open, I want to say, stakeholder kind of a group. So I'll stop there.
Perfect. Thank you so much, Sharon. And as you know, that the next section we're looking at is the roles and responsibilities, as well, where we will take on board some of that what you've said there. Gary, were you going to ask a question? Oh no. Apologies.
No, I was just showing my face because
okay, no problem.
Was.
No problem at all. The other thing that came to mind was, obviously we've got the membership, the kind of the wider membership, as you said, needs to be inclusive and needs to be as broad as possible. so conscious also that some organisations are much larger than others when we're talking on an organisational level. What are members' thoughts on organisational membership? So for example, the University of Liverpool, we've got a number of academics who have an interest, all who have different specialisms, but all who have expressed an interest in participating and joining in the community of practice. Should there be a limit on that, or are we happy that as long as the contribution is relevant to the work and the member is active, that would work for everybody? Any initial thoughts? Sharon, yeah?
Yeah, so I guess, one of the things that we think about when we do these organizational development stuff is to look at our colleagues in the business world, because there's a lot of data in the business world about what constitutes a group that actually can successfully develop a product or something like that versus too large or unwieldy. So I would suggest there is a lot of information. We don't need to make up these rules, but rather to take a look at what our colleagues in the business world have actually spent many years of stakeholder dollars developing, because they actually, some of them work and some of them don't work. And it's best for us to learn from those messages or development, the organizational development systems that they have. So I would suggest thinking, we in the medicine world, kind of are all inclusive, but our colleagues in the business world are not. And we each have our pros and cons, but when we're developing organizational footprints, table of organization, there's a lot to learn from them.
Yeah, definitely. Okay, and as I said, feel free to continue to share and comment after the meeting if anything comes to mind when you're reflecting on the discussion today. Okay, so that brings us to roles and responsibilities. So thank you for raising that earlier as well, Sharon. So some initial thoughts around that. We've got the COP members who will participate in discussions, share insight, attend events and collaborate on projects. Then do we need to look at a leadership? And is leadership the right word? Is governance more appropriate? And what would that leadership look like? Would it be providing some strategic guidance, as Sharon just talked about, having that rotation of expertise, representative from individual stakeholder groups? Would those stakeholder representatives come together as one, or would they simply lead their own stakeholder group? And also the kind of the coordination and what some people will call the secretariat. Is that just me? Do we need more resource? Do we have capacity? How does that look, and how, from previous experience of other networks and groups that you're involved with, what works best? So quite a few questions there. If anyone has anything initially they'd like to throw in, any initial thoughts? Gary?
Yeah, Rachel, thank you for those questions. One comment I have, and you refer to COP leadership and then stroke governance. I think governance to me, and I'm open to other people's ideas, governance to me embodies a set of rules or principles rather than leadership, which is what you defined here. So I think governance would sort of apply across the board to any thematic area within the community of practice, which is certain do's and don'ts, rather than on leadership, which I think you alluded to here rather well about strategic guidance and bringing the group together, etc. Over.
Okay, thank you.
This is something that we discuss extensively, also learning from other groups that are similar to this with similar objectives. And one key thing that we really want to avoid is creating jobs that are actually unnecessary and making it more difficult for people to find the time to contribute. So we're trying to see what would be most efficient to achieve what we really need to achieve. One thing that has come to mind is the themes that Rachel will be sharing shortly. For instance, could we have individuals to lead the different themes that are very relevant to the areas of expertise and experience? So that's one thing that has come to mind. Again, maybe when we get to that point, we can discuss what might that entail when it comes to what would it mean for them in terms of additional commitments and so on.
Yeah. So the next part of the terms of reference is actually around governance, Gowrie, and the plan initially, as Adeni has just alluded to, is to have a light touch model. So it's appropriate and works for the work that we're doing, and is constantly reviewed and evaluated, and not just taken for granted that we've got a governance model, that's us done. What would that look like? You know, do we have a steering committee to oversee that strategic direction? And is that where we get the representatives from each of the different stakeholder groups? And then do we have working groups or task forces who are working on specific initiatives, whether that's publishing white papers or project-based work as well? So initial thoughts around that. I guess it's the same conversation. I think we need to be really mindful, but also really clear on what the intention is for this. Who should be on the committee? I guess these are questions that that members probably need to think about as well. How do we nominate or elect? And the best way to organise those groups. After this meeting, I'm going to send out a short survey which will have some of these questions in. So don't feel pressured to think of answers now. If you need to reflect and come back on that, there will be an opportunity to do so. Okay, I'm just conscious of time. Finally, the final part of this section is around meetings and communication. So we have put dates in. Apologies for the confusion with some of the in-person dates. We've been floating a few around and speaking to a specific venue that we're really keen to host our in-person event in July. Lots of you have come back with availability. Many have said they would really like to be involved in the in-person meeting in July. And we have had a few say that there is a clash, unfortunately, with the IAS conference. So I just wanted to put this out there. Are these meetings, is the frequency of the meetings sufficient? The timings of the meetings is 90 minutes. Does that work okay for everybody? Is there anything here that's making you feel this is too much, this is not enough? Please share your initial thoughts.
Can I?
Sorry, I was on mute then, Joelle.
Okay,
Please.
that's fine. So I did share a comment in the chat about something that we talked about earlier, which is mainly around just inclusion, just ensuring that the regions that we're hoping to have an impact in are actually represented both in the membership and also on the governance. I just went through the list of members that you shared, and I think, you know, some conscious effort needs to be made to ensure that diversity, and also to, you know, that would equally boost, you know, agency and you know, just a welcome of whatever we might end up putting out for these particular regions that we're targeting. So in terms of the meeting time, I think 7 a.m. is I think 7 a.m. is like really early for at least for me in the US. So I don't know if it's possible to accommodate everyone, perhaps to I don't know, maybe to change the times sometimes. You know, some months we might want to have it, I don't know, maybe a little bit later. Some months we might have it at 7, just, you know, just to keep it balanced if possible. You know, I know it's probably also better for everyone to just know that it's once a month at this particular time rather than it having to move. I don't know, but 7 a.m. is just really early on this end.
We have sent out a doodle poll, which I will share again after the meeting with the times for that exact reason, conscious of different time zones.
Okay.
And we have had a few people request a slightly later in the day meeting. So we absolutely will rotate that. Thank you so much for raising it. It's really important. With reference to the membership comment that you made, we've had a quick kind of snapshot look, and we've got about 40% of members currently who are based in LMICs. I think that what we also need to consider is, or think about, discuss is being based in the LMIC is, you know, that's representation, that, you know, the grassroots, that's absolutely what we need. How about those members who perhaps that's where they're from, but they don't live there currently? How do we capture that and making sure that those that are working for organisations who aren't based in LMICs are still their experience as a living, working, learning, whatever within those countries is still included too. So all brilliant points. Thank you so much. So we will have a look at the date for the July meeting. So please bear with on that. And I'm sorry for the confusion with regard to the 13th of July, 16th and the 23rd were all floated about, and I think have caused some confusion. I take responsibility for that. Okay, conscious again of time, so we've very briefly put together a really short and snappy code of conduct. We've had some feedback on this already. Thank you to Dan, who I'm not sure if he's been able to join us, but has sent some comments. Again, what are we missing here? Who are we missing? And what do we need to expand upon when we're looking at this code of conduct for our members? I don't see any hands. I'm not going to assume that means that we've got this nailed on, and I do expect that there'll be some feedback that will come afterwards, and I encourage you to kind of reflect and do that as well. Okay.
Just to add a very quick comment that this is very preliminary. So any comments will be really welcome to shape this properly. But I think the key message we want to communicate is there will be a code of conduct that we will develop so that everyone would understand how we have agreed to work together as a group. So we'll properly develop that and share.
Yeah. Okay. I'm going to move us along to the next section of the meeting now, which is looking at the key themes. So once again, sorry, Gary, before I move on, did you have something you wanted to?
Yes, I had a thought, but I'd like, you know, maybe for others to mull over this. If we go back to code of conduct, when we talk about participation and, you know, expressing views, is there a separation of views in terms of our own expert views versus the agencies we represent? it's just a thought. Maybe it's not that significant. Just some clarity on that as well. Over.
That's noted. Thank you.
Yeah, thank you. So it's something we note for this code of conduct. Thanks.
Definitely. Okay, so when members completed the expression of interest form, there were some topics and themes that were shared with you, and some of you were kind enough also to suggest some topics that you would be interested in potentially hosting or presenting on at one of our future planned activities. So what I've tried to do is pull them together as best I could into some themes. Hopefully these are going to make sense to you. So these are the themes. There's 6 of them in total. The first one is dynamic paediatric and maternal physiology in long-acting therapeutics development. The second is formulation, design, technology and innovation. The third is long-acting therapeutic accessibility. We've talked about that quite a bit today, and implementation in LMICs. The fourth was stakeholder engagement and community participation. I know we have some PPI professionals who have kindly joined us as well. Theme 5 is around policy advocacy and dissemination, and theme 6 is the broader health system and ethical considerations. And again, I know that's been brought up today. So in order to address these and best make use of time today, we are going to attempt what's called a rapid insight session. Okay, so rapid insights is basically simple and interactive structure to gain insights from groups of stakeholders in brief. And it's going to be fast paced, like I feel this whole meeting has been so far, but encourage lots of information and ideas to be shared. And we hope that you will be able to share live and work towards the kind of co-design of the webinars and the workshops and the activities that are going to follow from this first initial meeting. There are going to be alternative methods to contribute. Would you rather reflect and give a little bit more thought? So I'll be sending out a document, a form that you can fill in with ideas that come up after the meeting's completed. So, as I said, we've got 6 themes that we would like you to provide your perspective and views on. And for each one, we'll have the same sequence. So there'll be thinking time, which is you and your pen and your paper, or your notes on your computer, whatever works best for you, or just sharing them live in the Q&A section of this meeting. Then you will enter your top 3 reflections into the chat when we have the feedback time. We'll summarise that. Hopefully we'll be able to do that live. If not, it may be that the summary will follow after the meeting. If people do want to stay on and reflect and discuss after the after 1:30 UK time, then feel free to do that as well. And we'll also compile and analyse the responses that we receive and use that then to plan our sessions going forward. Okay, so like I say, while the intention is to capture the kind of in the moment thought and that quick rapid fire, we are conscious that not everybody processes in that way. So if you don't feel this is for you, or if you're struggling to contribute in this way because you've got other things going on, that's fine. We can have a conversation about what best way for you to contribute your ideas around these different themes. Okay, so for each of your comments, we ask, so it's easy for us to organise and analyse, that when you are going to share your ideas, that you preface it with @regulator, if you identify as being from the regulator, if your thoughts are from that stakeholder group, or whichever identifier fits for you. If it's not one that's on the screen here, feel free to use your own that feels appropriate and relevant to you. So are we ready to try it? We've had such a rich exchange of ideas and thoughts around this. It's brilliant. We really didn't know how this was going to work out, so thank you for your participation. I think you've done this before. Okay. Feel free to continue to add in as we move on. So the idea was to try and summarize, but there's been that much content and that many ideas shared within the chat that I'm good, but I'm not that good. I don't think I can summarize within 8 minutes. So it will be shared with you after today's meeting, if that's okay. And then we'll also give those who had to leave us a bit earlier the opportunity to feed in, and again share that link, the feedback link, through. It's been a real, really interesting, really lively discussion, and I hope this sets the tone for our work together over the coming months and years. Shortly after the meeting, we are going to send a short feedback survey just to make sure that the pace and the tone and the content of what we've covered today is aligned and it feels at the right level for you. And also some practical things around. Some people have asked, will we share email addresses of members? We haven't done that to date when we've shared the member bios, which currently that document is an internal document for the community of practice. We'll want to know whether you're happy for us to share your email addresses within the community. Also things like LinkedIn profiles, if you want to connect offline outside of the group, we'll give you the opportunity to share that, and then I can disseminate that within the meeting. I'm going to stop sharing now because I've been staring at my slides for the last 90 minutes. I'm hoping I'm going to be able to see some of your faces properly before the end of the meeting. Dr. Olagunju, do you have any last comments or anything you'd like to say to summarize today?
Just to thank everyone again, and thanks to Rachel for coordinating this. The rapid insight session is my first time, but I've really enjoyed that. It really provides opportunity to gather a lot of input. So thank you. And thanks to all of you for joining. We know it's a difficult time for many of you. And even if it's middle of the day, it's still difficult because you're so busy. So thank you so much for joining. We really value your contribution, and we look forward to working with you to really drive developments in this important area.
Yeah, I echo what Adoni has said there. And the rapid, that's the first time I've run a rapid insight session, and you were absolutely incredible participants. So thank you very much for making that really easy. That bit was easy. I think it's going to be the analysis bit now that's going to be the difficult bit, and pulling all that together. But leave it with me. Thank you so much, and we'll be in touch really soon.